I'm Dr. Markman from City of Hope, and I'd like to briefly discuss two interesting, separate but related articles recently appeared, which touch on an evolving and critically important topic of artificial intelligence. The first paper was entitled "Patient Trust in Health Systems to Use Artificial Intelligence," and the second paper was entitled "Public Attitudes Toward Notification of Use of Artificial Intelligence in Healthcare." Both of these manuscripts were published in JAMA Network Open. In both cases, the studies were surveys using nationally representative U.S. adults from the National Opinion Research Center. And the first one was from June to July 2023. 2,039 respondents, 51% female, and a very reasonable representation based upon various ethnic subgroups. The general trust in the healthcare system was asked of this group, and on a scale of 0 to 12, the mean score was 5.38, already telling you that perhaps there may be a bit of a concern here. Now, turning to the question that we're highlighting here is the trust in the system to use AI responsibly. I'm going to say this and repeat it. 65.8% had low levels of trust in the healthcare system to use AI responsibly. 65.8%. 2 out of 3 patients said they had low levels of trust in the system to use AI responsibly. This is in my opinion, a really serious statement about how the public is viewing the situation. Further, 57.7% had low levels of trust of their healthcare system that to be sure that AI would not harm them. More than half said they had a low level of trust that their system would make sure that AI would not harm them. Very concerning. And in this second study, interestingly, there were 2,021 respondents. Again, a slight majority, 52% were female. The question that was asked was, it is important that I am notified about the use of AI in my healthcare. So that was a statement, but the question was, how important is that statement? And 62.7% of respondents said, and this is the highest level, it was very true that they wanted to be notified. They wanted to be notified if AI was being used in their healthcare. And only 4.8%, or 1 out of 20 patients, said they didn't want to be notified. So clearly, 1, patients want to know it's being used. They don't want to be used without their knowledge. And 2, they are fearful, concerned. I think all members of the healthcare environment, including doctors, nurses, healthcare administrators, payers, need to listen to this. The public is concerned based upon what they read, what they've heard, podcasts they've listened to, social media. They're concerned about potential risk of harm, and they don't necessarily trust their own healthcare system now to do its best for them. It's a critical message. It needs to be heard, and I actually agree with the opinion of the majority of the public about that potential concern. And I thank you for your attention.